Hi everyone, my name is Elena Vince and I am a physical therapist and owner of Oxbow Health and Wellness as well as Great Lakes Pelvic Rehab. And today I want to talk about a taping mechanism to improve stability in the shoulder joint. The shoulder joint is a pretty unstable joint outside of joint hypermobility. It's technically a ball and socket joint, but the socket is really shallow, especially when we compare it to the hip. So the hip joint is a really deep ball and socket. But when we look at the shoulder joint, that socket is so shallow that head of the humerus has a lot of room to move around in. So this is already a problem joint for a lot of people. But if you have joint hypermobility, this can be a huge problem, right? Because now we have decreased support from connective tissue. Muscles are probably a little bit weaker and not providing enough support to that area. And it can just feel overall really painful. What I see in a lot of my patients that have joint hypermobility is they can have almost a little bit of a divot in the side of their shoulder because that head of the humerus is so depressed. You can see almost a space in between the top of that socket and then also the ball of the head of the humerus. So when we have these saggy shoulders, it can be very, very painful. It can be hard to engage muscles around that area, so it can affect strengthening. So my rule of thumb is you don't just tape something and forget it. You tape something to improve stability, decrease pain, so that then you can do the exercises to overall improve that joint function. So today I want to show you how to decrease the saggy shoulder syndrome there with some Kinesio tape. So this Kinesio tape is the stretchier tape, right? You can think about doing a max pull, which is 100% pull on that tape. We very rarely want to do that maximum pull, maybe usually around 50 to 75% or so. I don't make my strips very long. This is about 6 inches or so. And also make sure you taper the edges there. If you keep it squared off, it's more likely to peel off sooner. Make sure you have no lotion or anything that's slippery on your shoulder that could decrease the adhesive power of the tape. You're going to leave the backing on to start, but then think about doing a little bit of a tear about 1 inch in. You're going to do this on 2 strips of your tape, both about the same size. So the point of this tape is to help the deltoid muscle in providing a good shoulder set here. So what the deltoid is it starts kind of right around here or so, a couple inches down from the shoulder joint. And this muscle is a triangular muscle that goes up and over the shoulder joint. It helps you to bring your arm out to the side, up in front, and a little bit of extension behind. But when the rotator cuff muscles aren't helping to approximate or bring closer the head of the humerus into that joint socket, we rely a lot more on that deltoid to provide that extra support. So if we give that deltoid a little extra help, now we can strengthen the rotator cuff, we can strengthen the deltoid, we can strengthen our biceps and triceps a little bit more effectively so that that shoulder joint functions better, has improved stability, improved strength, and decreased pain. So this tape is meant to mirror that triangular shape of the deltoid. So what you're going to do is you're going to peel off that 1 inch part of the backing. And you're going to think about angling the tape from the center of your arm here. That's where you're going to anchor it. And you're going to pull it up and over this way. So I usually set my anchor. I rub it in a little bit so it sticks better. Then you're going to peel some of the backing off, but still leave about 1 inch or so still attached. I like to use an arm rest to give my shoulder that little bit of extra support. So your arm's not hanging down while you're taping. You're giving that little bit of extra support so that your shoulder is about where you want it to go. You're going to give about 50% pull up into the shoulder joint there. This is strip number 1. And I like to rub in on the tape because the heat helps the adhesive to stick a little bit better. All right, on to strip number 2. We're thinking about aiming this one back a little bit more. We want these to be about the same amount of pull so that it doesn't feel like the tape is pulling you more forward or more backward. Okay, so again, you're going to peel off the 1-inch part of the backing. You can line this up and think about putting the anchor again around the same spot as the other anchor. Give your arm that little bit of extra support. And here's where joint hypermobility in your neck helps a little bit, so you can see the back of it. Obviously, if you have a friend or partner that can help with this, that's way easier than doing it yourself. All right, so you're going to peel some of the backing off a little bit. Give about a 50% pull, and then pull back. Now, something to consider when taping is that you don't want that last little bit of the tape to be on stretch. You want to stretch the middle 50% of that stretchy band. And then same as before, you're just going to rub that in so it gives a little bit of extra support. Now, if you feel like your shoulders really round forward a lot, that can impact your shoulder function as well. So with some folks that I work with, I will do these 2 strips, and then I will add a 3rd strip right along the shoulder blade here, the scapula, and think about trying to pull back. So that line might go from the middle of my scapula towards my spine. And that's a gentle pull, not even 50% for that. This tape can stay on in the shower. Usually it lasts anywhere between 3 and 7 days before it starts to peel and get really irritated. Things to consider when you might not want to tape. If you have MCAS or any sort of allergy to adhesives, this might not be for you. If you don't know if you have any irritation with adhesives, pay attention to your skin. If it starts to get red, itchy, you start to see small blisters form, take the tape off. It is not worth it to keep it on for that shoulder joint stability. There are other things that we can do. Like I said before, don't just tape it and forget it and say that it's good to go. If you're having shoulder instability, pain, weakness, issues in that shoulder joint, the tape can help, but it can especially help you to tolerate doing exercises more so that we can improve that overall joint stability. If we improve the strength of the deltoid as well as the rotator cuff muscles, that joint will naturally become a little bit more stable and we can decrease pain. So put the tape on and then work on a progressive program for strengthening that shoulder joint. Capiche? Now, if you don't know where to start with strengthening the shoulder joint, I do have a program. It's called the Strong and Bendy program. The link will be down in the comments or in the description. This is a great program for gradually building up that shoulder awareness, muscle recruitment, joint stability, and strength. It is very, very slow and progressive because folks with Ehlers-Danlos syndrome and connective tissue disorders, we don't want to do too much too quickly because it's going to feel pretty terrible. But if we gradually progress it and start to wake those muscles up in a meaningful program, that can be really beneficial. If there are other questions or concerns or something else you'd like to see, shoot me a message or a comment. Hopefully this helps. I have found this to be beneficial in my own shoulder injuries in the past, as well as with patients that I've worked with that have had shoulder injuries from trauma, from sleeping weird, or just from progressive overload incorrectly in a less stable joint system. Good luck, stay strong and bendy.